ever felt trapped within a body that is no longer your ally, faced disbelief even from medical experts while suffering an inexplicable pain? Today we journey with Jane, a brave woman who experienced just that. We dive deep into the tempestuous and often misunderstood world of fibromyalgia. Hello friends, welcome to Diagnosis Diaries. This is a sanctuary for everyone who seeks insight into the extraordinary tales of medical challenges, the hidden heroes who face them, and the triumphs achieved. We aim to illuminate the often veiled journeys people endure, providing a platform for awareness and understanding. If you are new, subscribe and hit the notification bell. You wouldn't want to miss the intriguing stories that unfold here. Meet Jane, a vivacious 36-year-old dedicated to caring for abandoned and mistreated animals. She was a beacon of hope in her rural New England town, running a pet sanctuary that provided a haven for animals who were abused, neglected, or had nowhere else to go. Jane had a heart as vast as the open pastures her sanctuary sat upon, extending her care and compassion to the numerous animals she took in. Her life was everything but ordinary, starting at dawn with the crowing of roosters and often ending well past sunset, as she tended to the needs of every one of her furry, feathered, and even scaled companions. There was no animal she wouldn't help, and her dedication was unmatched. Despite the challenges of running the sanctuary, Jane loved every minute. Her sanctuary was not just her job. It was her life. Jane found joy in the purring of the cats, the wagging tails of the dogs, and even the sometimes too early crowing of the roosters. But as time went by, Jane started noticing changes in her energy levels that couldn't simply be written off as exhaustion from her demanding lifestyle. At first, she brushed it off, attributing it to the physical demands of her job. But as the exhaustion became persistent and more intense, it started interfering with her ability to care for the animals, which she loved so much. Jane began to realize this was a fight she couldn't win alone. It was time to seek help. The early signs were insidious. Jane experienced muscular aches that seemed to permeate her entire body. These were coupled with a constant fatigue that made her feel like she was walking through a thick, tangible fog, no matter how many hours she slept. Additionally, her mood began to oscillate, causing her to become unusually irritable. Dismissing these initially as signs of her demanding job, Jane hoped they would dissipate. However, as the weeks rolled on, her symptoms did not fade, but intensified. Jane's discomfort escalated into constant searing pain that gnawed at her muscles and joints, causing her to wince with every movement. The unending fatigue escalated into a crushing wall of exhaustion, making even the most mundane tasks seem Herculean. The most unsettling symptom, however, was the cognitive impairment she began to experience. Known as fiber fog, Jane found herself struggling with tasks that once came effortlessly to her. Her memory began to falter, and her concentration waned. Baffled and scared, Jane sought medical help. The initial interactions with healthcare professionals were disheartening. Despite numerous tests, blood work, CT scans, MRIs, each came back as normal. Though seemingly positive, each clean bill of health only added to Jane's mounting frustration. The lack of a clear diagnosis led some doctors to suggest that Jane was merely stressed or suffering from depression. These dismissive attitudes were devastating to Jane. It was as though her suffering was being invalidated, leading to a feeling of helplessness. In her desperation for answers, Jane turned to alternative forms of healing. She sought help from a local acupuncturist, engaged in chiropractic sessions, and even started incorporating herbal supplements into her routine. These interventions provided temporary relief, and Jane would feel a semblance of her old self for fleeting moments. However, they failed to offer a long-term solution, leaving Jane's main issues unresolved. Her medical quest began to feel like a never-ending trek across a barren desert, each new appointment revealing another mirage of hope. Along her journey, Jane encountered dismissive healthcare professionals, bewildering medical jargon, and a healthcare system that seemed unprepared to solve her complex case. However, this challenging journey also led Jane to meet individuals who would profoundly impact her journey. Among these was her compassionate yoga instructor, Lily, who introduced her to the concept of mindfulness and coping strategies for pain management. At the peak of her isolation, Jane ran into a former colleague, Mrs. Walters. As they were catching up, she suggested Jane visit Dr. Sullivan, a rheumatologist known for his compassionate and thorough approach to his patients. Stepping into Dr. Sullivan's office marked the turning point of Jane's medical journey. His earnest demeanor and patience in listening to Jane's entire history were like a breath of fresh air. He reassured Jane that her symptoms were real, not figments of her imagination. After hours of diligent examination and careful consideration of Jane's symptom history, Dr. Sullivan suggested that Jane might have fibromyalgia, a chronic condition characterized by widespread pain, fatigue, cognitive difficulties, and sleep issues. But before confirming his suspicions, he needed to rule out other diseases that present similarly. The weeks that followed were filled with further medical examinations. Jane underwent extensive blood tests, X-rays, and neurological evaluations to rule out other conditions like lupus, hypothyroidism, and rheumatoid arthritis. Dr. Sullivan also carried out a tender point test, a specific exam where he applied gentle pressure to the 18 specific points on the body that tend to be painful in fibromyalgia patients, not others. Jane experienced discomfort in the majority of these points. Finally, after 6 grueling months, Dr. Sullivan confirmed the diagnosis, fibromyalgia. Although the diagnosis was daunting, there was also a sense of relief. Jane's suffering had a name, and her experiences were validated. Despite the uncertainty of what lay ahead, Jane was grateful to have a starting point for her fight. Jane's diagnosis was met with mixed reactions from her friends and family. While some struggled to understand the complexity of her invisible illness, others offered unwavering support. Notably, her parents, who, despite living in Florida, made regular trips to help her manage her condition. Despite not fully understanding the situation, her friend Lily, the yoga instructor, was always available to provide a listening ear or help with relaxation techniques. And of course, Mrs. Walters and her Labrador, Bingo, stood as steady pillars of support. Fibromyalgia is characterized by chronic widespread pain, severe fatigue, sleep disturbances, cognitive difficulties, and even psychological distress. This condition is a master of disguise, often mimicking other ailments and slipping past initial evaluations undetected. Affecting an estimated 2/4 of the population, fibromyalgia predominantly targets women, accounting for nearly 80-90s of diagnosed cases. However, it's important to note that this condition doesn't discriminate and can affect individuals regardless of age, gender, or ethnicity. While the average age of onset tends to range from 20 to 50 years, cases have been reported in all age groups, from children to older people. The ambiguity surrounding fibromyalgia doesn't just lie in its wide array of symptoms. A significant challenge that both patients and healthcare providers face is the absence of a definitive diagnostic test. Unlike conditions such as diabetes or hypertension, where a simple blood test or measurement can confirm the diagnosis, fibromyalgia lacks such precision. Often, the diagnosis is reached through a process of elimination, ruling out other possible conditions that could be causing the symptoms. Conditions such as rheumatoid arthritis, hypothyroidism, or lupus can mimic fibromyalgia, further complicating the diagnostic process. Doctors will typically conduct a series of tests, including blood work, imaging studies, and even nerve conduction studies, to rule out these conditions. Even more frustrating is the reality that most people endure a lengthy waiting period before receiving a definitive diagnosis. On average, patients go through 3.7 years and consult with 3.5 different physicians before being diagnosed. This delay prolongs the suffering and contributes to increased healthcare costs and reduced quality of life. For Jane, managing her fibromyalgia wasn't a quick fix. Under Dr. Sullivan's guidance, she embarked on a multifaceted treatment plan. This included prescription medications like duloxetine and pregabalin to manage her pain and sleep disturbances. A physical therapist taught her graded exercise therapy, helping Jane slowly rebuild her strength without exacerbating her symptoms. In addition, Dr. Sullivan emphasized the importance of incorporating holistic practices into her regimen. Jane began attending regular yoga classes, focused on gentle movements and deep breathing techniques, a valuable tool for managing her pain and stress levels. She started a mindfulness meditation practice, learning to manage her anxiety and cultivate a deeper understanding of her body's needs. Over time, these practices became an invaluable part of Jane's routine, helping her regain a sense of control over her life. Dietary changes also played a significant role in Jane's management strategy. She started working with a nutritionist who helped her identify potential food sensitivities and develop a balanced, nutrient-rich diet to help manage her symptoms. This involved incorporating more anti-inflammatory foods like fruits, vegetables, and lean proteins, and limiting proteins and limiting processed foods and sugars. She included omega fatty acids, found abundantly in fish oil, known to have anti-inflammatory properties and benefit oral health. A 2017 study published in the journal Pain found that omega supplementation could help reduce pain intensity in people with chronic pain conditions like fibromyalgia. Additionally, magnesium deficiency has been linked to fibromyalgia, and several studies, including a 2013 paper published in Rheumatology International, suggest that magnesium supplementation could help alleviate symptoms. Lastly, rhodiola rosea, a natural adaptogen that can help the body manage stress more effectively. According to a 2009 study published in the Spine Journal, rhodiola rosea could improve sleep quality, a common concern for many fibromyalgia patients. If you suspect your nutrient levels are low, you can find the links to these products in the description below. Please note that the information given should not replace medical advice, and it's crucial to consult with healthcare professionals. What worked for Jane might only work for some, as each individual's body and condition are unique. That's why a personalized approach is vital when dealing with chronic conditions like fibromyalgia. Despite these measures, Jane's journey wasn't a linear progression towards better health. There were days when the pain was unbearable and fatigue weighed her down like a lead blanket. But even in these moments, Jane held on to the hope for better days. She found solace in a local fibromyalgia support group where she met other people dealing with the same struggles. They shared experiences, coping mechanisms, and most importantly, offered each other understanding and empathy that was hard to find elsewhere. Despite the difficulties, Jane was slowly learning to navigate her new normal, finding joy in small victories and gradually reclaiming her life piece by piece. The takeaways from Jane's experience are the resilience of the human spirit. Despite the physical pain and mental distress, she refused to be defeated and instead chose to manage her condition actively. Importance of a strong support network. Jane's friends and family provided unwavering support throughout her journey. They didn't just offer emotional comfort, they also helped her navigate the healthcare system, research her condition, and make crucial lifestyle changes. This emphasizes the critical role of a robust support system in managing chronic illnesses. Patient-centered healthcare. Jane's story underlines the importance of a healthcare approach that respects and responds to individual patient preferences, needs, and values. Dr. Thompson's empathetic approach, and willingness to explore beyond the traditional medical protocols ultimately led to Jane's accurate diagnosis and effective management plan, integrating conventional and holistic practices. Jane's management strategy didn't solely rely on pharmaceuticals. It integrated conventional medicine with holistic practices like yoga, dietary changes, and mindfulness. This combined approach was vital in managing her symptoms and improving her quality of life. Listening to our bodies and advocating for our health. One of the key lessons from Jane's story is the importance of listening to our bodies and advocating for our bodies and advocating for our health. Jane recognized that something was seriously wrong. Despite her initial medical dismissal, she persisted in seeking help, illustrating the importance of advocating for our health, not defined by illness. Despite living with fibromyalgia, Jane is not defined by her illness. She's a woman who loves animals, works at a pet sanctuary, and enjoys spending time with friends and family. Her story is a potent reminder that while chronic illnesses can alter our lives, they don't have to define us. If Jane's story resonates with you, or you know someone who could benefit from hearing it, please share this video. And if you've missed any of our previous stories, please check the end screen for other captivating narratives. Remember to hit the subscribe button and notification bell to stay updated on future episodes. Thanks for watching Diagnosis Diaries. Here's to health, understanding, and compassion.